When many of our clients, patients and their family members, their carers, come into our service, they've already gone through quite a gruelling time and they've experienced a number of losses through the trajectory of their illness. Loss of physical integrity, loss of independence, loss of role. And so we know that grief is a normal response to loss. And grief is experienced at many levels. It's experienced physically, emotionally, mentally, psychologically, and also spiritually. An important aspect in grief is time. And I think this plays a role around when it's appropriate for a person to either be referred or to seek bereavement counselling. There has been some research done that suggests that people who self-refer or people who seek out support in their own time and when they feel the need perhaps do better than those who are told, you must go and talk to a counsellor. When someone has died, the people who are affected by that death need time to gather their own personal resources, their own coping mechanisms around that. And these are coping mechanisms that have been built up over a lifetime, that they've used in various other stressful events and times or other losses in their lives. And then there's need for time to build community resources around them. We know that social isolation is a risk factor for grief, and so to be able to not only pull together your own resources but to bring around you friends, family, community supports the person who's grieving. The first 7 days is an enormous milestone. 7 days I've survived this long since the person has died, and then you've got the month, you've got the first anniversary, and there can be significant events such as a birthday, such as an anniversary, Mother's Day, Father's Day. So it's important to be aware of these things and whether they have significance for the person or not, because that may be time when they would want to seek support. Some people come in for counselling closer to the anniversary, or they may come in around other significant events.
After the death of a loved one, there are little things that are so difficult. After Sonia's death, I found it a real pain to shop for one, to cook for one, and you think, I won't cook a decent meal tonight, I'll just get out a can of baked beans. So you need some guidance, maybe training in how to look after yourself after the death of a loved one.
Yeah, it's very important to have Aboriginal people around us, at the end of our days, when we're leaving this world, because, we come from big families, and a lot of our people can't even fit in the hospital wards, There's that, we're all from big families, and so it's very important that's where it's very important too, to have, the more trained Aboriginal workers to be in the home with our people. And our people are very proud people, and, and that's where, they want to have dignity, in their last days, and that's very important. I think by being in the aged care at the hospital was a lot of family member. Well, we had to think about the other patients as well, and we had to respect them as well, because when things like this happen, you can't hold your grief in. And we had to remember there was other people in the wards next door, and which was really sad for us. I believe, if there was more Aboriginal people, trained as grief workers and, in a way of grief and loss, that would have helped my grieving as well.
The patient needs to be reassured that their families and loved ones will be supported afterwards, and families need to know that if they need it, if they want the support, if they want professional help, that palliative care services and health professionals can provide them with information on where to go and what to do.
I've written here, Definitely there's support afterwards. After Mum passed away, there's a lot of support available, not only from Mum's specialists and everyone that was involved in her end-of-life care, but knowing that, I suppose, that we, just having that thought process that we did everything for Mum that we could, we granted her wishes, was a huge part of, I suppose, our grieving process, knowing that we were able to tick a lot of those boxes for Mum. And we did it as a family. I was, I suppose, that person that always would refer people on. So when I actually had to utilise a psychologist myself and a counsellor, it was quite difficult. From one health professional to another, thinking, oh, I'm losing my mind, I can't sleep, you know, and I suppose not combating the situation, but probably just getting on with it earlier, getting on with it too soon, and not allowing myself to grieve properly. Yeah, you've got your family, but sometimes you actually need that person that's not part of your family to break it down and put it back together. Yeah.